Track 4. Introduction. This track is approximately 5 minutes long. Introduction. 15. We want to ensure that we have a welfare system that is fit for the future. A system that supports work for people who can, provides a safety net for people who need it, and that is fair to the taxpayer. This consultation seeks views on whether we should make fundamental changes to how we support disabled people and people with health conditions, and whether our system delivers the right support to people most in need. 16. The consultation will focus on the primary extra cost benefit that provides support to adults of working age with additional costs of having a disability or long-term health condition. Personal Independence Payment, PIP. The views shared during this consultation period will be used to help shape the future of the health and disability benefit system. 17. PIP is a non-means-tested, tax-free benefit which contributes towards the additional costs that disabled people and people with health conditions can face as a result of their disability or health condition. It is often described as an extra cost benefit. It is paid at various rates depending on the level of functional impact of a person's disability or health condition. You do not need to have paid national insurance contributions to receive PIP, and it is not affected by any earnings or other income you receive, nor is it affected by any capital or savings you have. You can claim PIP whether you are in or out of work. PIP is not dependent in any way on your ability to work, and around 16% of PIP claimants are in work. PIP is almost always paid in full, in addition to any other benefits or tax credits that you are in receipt of. 18. PIP was introduced in 2013 to replace Disability Living Allowance, DLA, for claimants of working age. It maintains a long-standing approach of the government providing regular cash contributions in recognition of the additional costs that people with disabilities and health conditions face. These additional costs are not defined, and claimants are able to spend the money they receive according to their own priorities. Additionally, PIP was intended to reflect mental health needs better than DLA. 19. PIP can provide access to top-ups, called disability premium payments or additional amounts, for some income-related benefits, including employment and support allowance and housing benefit. PIP may also passport to other support including, but not limited to, carer's allowance, benefit cap exemption, council tax reduction or exemption, access to the Blue Badge Scheme and the Motability Scheme. Refer to Chapter 1 for further information on current PIP eligibility. 20. PIP was intended to differ from DLA by being fairer, by paying greater regard to needs arising from mental health, sensory and cognitive conditions, more consistent, through eligibility criteria, more objective, through health professional assessment, more transparent, easier to understand, sustainable, through regular reviews, and more modern and dynamic, focusing on people with the greatest barriers to living independently and/or participating in everyday life. 21. In this Green Paper, we will consider whether we should make fundamental changes to the way we provide support to disabled people and people with health conditions. We want to hear how the welfare system could be redesigned to better direct financial support to people with the highest costs, or to improve provision of other forms of support such as access to health care. 22. This consultation also aims to consider where there are opportunities to join up services in local communities, aiming to enhance the support offered to better meet the needs of disabled people than the current system. We would like to consider how we could better align the support offered by PIP with local NHS health and social care provision, to provide better support for disabled people. 23. Engagement with disabled people, people with health conditions and their representatives is essential to the development of future policies and will inform the government's next steps. We welcome all views during the period of consultation. This concludes Track 4.